Hey, in this video I'm showing a technique we're going to use to get some diaphragm activity as we breathe, as well as some expansion in the rib cage and some down regulation or some settling of just the whole system. So the diaphragm is a muscle that is our primary muscle of breathing that's kind of in underneath the rib cage. And then the ribs, they start in the front, but then they have an attachment with the thoracic spine, the mid and upper back. And those attachment points, there are joints called a costovertebral joint. There's some movement there. Often I find that folks have a breathing pattern where they breathe with their neck and shoulders, and they don't use the diaphragm as much, or they only expand in the abdomen but not into the rib cage. That can be due to a number of different reasons, but the end result is that the rib cage doesn't expand and those rib joints can get less mobile than we maybe want. And so we're going to use a technique to try to get some expansion in the rib cage, reactivate the diaphragm, and this can also just help to settle things. So here's a technique. We're just going to lay down in a comfortable position with some support under the legs. And so I've just got a few pillows here. Your legs could be a little higher. Whatever is comfortable for you, I just want you to get a position where you're relaxed. Then we're going to get the hands right on the bottom of the rib cage here. They should feel fairly comfortably and just kind of relaxed on there. After that, you're going to take a breath in through the nose, a quiet inhale, and then exhale like you're trying to fog up a mirror. So when you exhale as you're trying to fog up a mirror, I want to exhale all the way and feel with your hands. Don't push, but just feel the bottom of the rib cage coming down. On your next one, inhale and just get a little extra force at the bottom of the exhale to feel a little abdominal and core muscle engage, maybe a bit on the side and a touch in the front, but we're almost kind of continuing that drawing down rather than pushing up. After that, you're going to hold tension, light tension, not a ton, just light tension of those abdominal muscles, keeping the hands here, and you're going to breathe in without letting the tips or the bottom of the ribs go up. And so what we hopefully want to feel, light tension. Inhale is some expansion through the sides of the rib cage, the chest, maybe the mid-back. Hold some tension, inhale. Exhale. So good rule of thumb is that we want to hear the exhale, but not the inhale. So at the inhale to be nice and relaxed. I don't want to squeeze the neck muscles or the low back muscles. And on the exhale, a little slower than the inhale and a little tension, but I don't want the low back to kick in. I want to kind of pull down and maybe feel some muscle tension here. Keep that on as you take your next breath, trying to expand almost towards your forearms. And so this can sometimes be hard to feel at first. So just be patient with it and give it a couple of minutes and trying to do some of the breathing. Just slow in, slower out, and trying to just feel, where is that breath coming from? Can I feel any of these muscles engage? Can I feel my rib cage kind of expanding out? The rib cage is roughly a cylinder. We're trying to get expanding in 360 degrees rather than upward. And so I'm trying not to do this with my chest. I'm trying to expand through here, not up. And so typically prescribe a couple of minutes of just working with this in a comfortable position. And then as you get up and moving throughout your day, just seeing as you come up, can you then, without as much kind of the setting up, can you maybe feel that through the rib cage in different positions. And then can you take that into movement, walking, maybe light exercise. After I do this, I typically want to come back to just breathing in and out through the nose rather than through the mouth all the time. But that kind of fogging up a mirror technique can often help to get the right things engaged. So give that a shot. Of course, don't breathe so deeply that it's painful. Don't continue with anything that's uncomfortable, but we're just trying to feel some expansion of the breath in some different areas than you might normally.